Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Cachola. I'm here with PAR5 Physical Therapy, and I've partnered with them to bring you an easy and educational workday session. Today's session is perfect posture the key? So we're going to answer the question about perfect posture. A little bit about me. I've been a physical therapist for over 25 years, and I got my doctorate from Mercy College and an exercise physiology degree from Rutgers University. I'm a board certified orthopedic clinical specialist, a Titleist Performance Institute certified golf medical professional, and most recently a dry needling specialist. So we all know, let's get into it. We all know that sitting for prolonged periods of time can create aches and pains. Now we're going to learn what perfect posture is and if it's important. So I'm going to bring up my slides here. So as with every talk that I've done, because I'm a physical therapist and medical professional, I have to give this disclaimer here. This is not physical therapy. The stuff that we're going to talk about today is general advice aimed at a broad population. So if you're dealing with something specific, make sure that you get a physical examination from a medical professional to address your specific needs. All right. So with that in mind, remember that the body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, pain or injury is the result. So if you remember anything from any of my talks or any of my classes, just remember this one thing, that this pattern of alternating stability and mobility is key in addressing a lot of these issues. Oh, there it goes. Now my video is loading. Take a second. A lot of internet issues today. But anyway, this alternating pattern of stability and mobility gives us a baseline of what the roles are in body parts. So if we're having an issue or pain in a certain area or a certain region of the body, it probably is due to something above or below that segment that's not doing its role. When roles get reversed, when segments reverse their role, then usually they're changing what happens in the next segment. And that's what usually causes injury or pain. Say, for example, if we take the lower back is supposed to be a stable segment here. If the thoracic spine, the segment above, or the hips, the segment below, is not as mobile as it should be, then the lower back tends to become an unstable segment. It reverses its role. It tries to become mobile because you lost that mobility at the hips and the thoracic spine or the thoracic spine. And then that's where we get pain. All right. So posture and sitting, you're probably sitting watching this on your phone or on your laptop or iPad or whatever. There's always this thing, a lot of clients ask me, like, if I'm at home, I'm working, or if I'm even standing, waiting in line, any prolonged static positions, what posture should I be? Is there a perfect posture? Well, I'm here to tell you that there's no such thing as perfect posture. Our bodies were designed for movement. So if we look at the tissues and the structures of our body, they weren't designed to stay in one position for too long. What tends to happen, our bodies assume the positions and postures we place them in, and that tissue can get very, very stiff. So we all know that feeling, how our body feels if we're just in one position for too long. And what is that feeling? Well, inside the body, in between all the fibers of the muscle, underneath the skin, there's this structure called fascia or myofascia, depending upon where you find it, right? Fascia is this connective tissue that fills in all our spaces in our body. It gives our body its framework. It gives our body its shape. If muscle didn't have fascia in it, it would just be hamburger meat, right? So it'd be just destructured. That fascia changes in consistency depending upon our daily activities. So with movement, that fascia looks like a spider web in the morning. It's very hydrated, it's loose, it's supple, it can slide, it can move. If we don't move and we're super stiff, then what happens is that fascia can dry out, become desiccated a bit, more stiff, more adhered and sticky, So it's not as sliding, it doesn't slide as well, and that's what creates stiffness. And if we do that enough times, our body learns that that stiffness is the way it should be, either due to a protective mechanism because of pain, or just because of the adaptations that we place on it because we are in one position for too long, okay? So let's do a posture check. Let's think about this. The spine, if you look at it, has these curves, all right? So we have basically three curves of the spine. We have the cervical curve, which kind of like goes forward a bit, and then the thoracic curve, the mid-back, which kind of comes back out a bit, and then the lumbar curve, which comes forward again as well. And then there's the pelvis, which has its own little curve. But that's part of the pelvic area. That's a sacrum, really. The sacral bone connects with the pelvic, the hip bones, and that creates the pelvis. The curves of the spine allow the spine to be more resilient, absorb shock, and they're more durable versus a straight spine. So what happens if we have problems or pain is when we get into a position where there's parts where there should be a curve, but there's not a curve, it's totally straight, or the curve is too much. All right, so how do we check this? Let's do a posture check. Let me pull up my two-shot here. I've got the wall over here. I'm gonna turn my camera a bit so you can see me this way. So what we're gonna do is we're just gonna stand up, we're gonna grab a wall. And what I want you to do is we're gonna put both, we're just gonna stand up against the wall, all right? Vertical surface, doesn't matter. You can use like a door jamb or whatever. You're gonna get your hips, shoulders, and head against the wall. Your feet can be away from the wall about a foot or two, depending upon how comfortable you are. And then we're gonna bend the knees. So as we bend the knees, that gives our hips a little slack so we can kind of get them flat against the wall. Your mid-back should be against the wall, right? So you should feel those 2 points of contact. The key thing is what happens when we get the head against the wall. If we get the head against the wall, first, can we do it? Or two, when we do get it, is our head straight, right? So oftentimes I'll get clients coming in here that they feel their hips, their lower back, and their mid-back touching, all right? So those are the three parts that they feel touching. Really, we just want pelvis, the hips, and the mid-back, all right? So that's step one. Step two is sometimes when they feel the pelvis and the mid-back touching, they can't get their head back, they tend to look up. So they'll say, all right, my head is touching the wall, but I'm looking up. My chin is up, my gaze is up. That's basically because of a thoracic, a mid-back problem. So ideally we want hips, shoulders, and head. When we bring the head to the wall, the chin should be down, and we should be relaxing this position, all right? So this gives us a reference of what is straight, all right? And if I took it into a standing position or a total body straightness position, I can get my heels against the wall, hips, shoulders, and head. That's my feeling of straight. And then when I step away, that's my reference point. I should be able to say, all right, this is straight. My ears, my head are lined up over my shoulders, and my rib cage is lined up over my pelvis, okay? So a couple of things we could think about with standing posture is that we want all those curves to be stable. If we have too much of a lumbar lordosis, it kind of looks like this, with the pelvis kind of tipped forward, and we get this hyperextended back. And that could be due to a lot of reasons, tight hips or tight back or something. But if that happens, then we get this overextension of the abdominal area, this belly area. This is short, this is long. Those muscles that are short, they remain tight. They're happy to be short and tight. Muscles that are on stretch or lengthened, they become weak. So we have a weak abdominal section and a tight back. So that could be contributing to why the back is tight if the hips cannot get straight. So what I want you to try and do to get your back straight and reduce some of the back pain that you might get in standing is just to get your feet shoulder width apart and make sure that they're totally pointed forward. Okay, so from the side view, totally pointed forward. And then from here, I want you to squeeze your glutes. I want you to activate the glutes. And what that should do, if you're in this anterior tilt, if you contract your glutes, that should tuck that pelvis underneath you. That should normalize the pelvis alignment. And then from there, if we think about the pelvis being a basin that we just leveled out, a basin that's filled with water to the rim. We don't want the water to spill forward. We don't want the water to spill backwards. If we get that neutral with that glute contraction, then we can look upstream and say, all right, where do my ribs and my mid-back need to go? I maintain that contraction down here. And then I say, all right, can I slouch and can I overextend the thoracic spine where I feel that my thoracic basin is also level, it's not tilted up, not tilted down. And then from there, I create a little bit of contraction through that deep abdominal muscle called the transverse abdominis. And then I can turn off my glutes and function normally. When we are upright against gravity and unsupported from the back of a chair or something, this abdominal muscle, that transverse abdominis, should be always on. It should never turn off. A lot of times chronic back issues stem from the inability of that muscle to be on, at least hold some certain type of low-level tone to support your trunk, your arms, as you're going throughout your day in an unsupported position like standing or walking or doing whatever, okay? So that's a standing posture assessment. We can take the check against the wall, hip, shoulders, head. If I can get my heels, awesome. Is the head pointing down? Now, an exercise that you can do to reinforce that, if you can get into that position, is a thing called the Brugger pose. So we don't have to get the feet against the wall for this. We can get the hips, shoulders, and head. We want to make sure that the shoulder blades are against the wall, the head is against the wall, chin stays level. We're going to take the hands and then place the back of the hands on the wall. Oftentimes when I say, let's place the back of the hands to the wall, everybody just does palms. This is so much easier and not the position we want to be in. The Brugger pose is the back of the hands to the wall. And then from here, the closer I can get my hands, my back of my palms to my hips, the better. If it's too tight or too difficult, we can give you space, all right? From here, I'm just gonna pull my shoulder blades back and down, maintaining hips, shoulders, and head against the wall, and then push my fingers to the floor. Once I do that, I should feel a lot of tension down low in between my shoulder blades. And if I hold this for 10 seconds or 20 seconds or 30 seconds, or even if I can hold this up to a minute or accumulate a minute of 60 seconds of constant tension, that will help reinforce this proper position and build up the muscular endurance of all the muscles that hold you up against gravity. All right, so that's standing. All right, any questions from the room, let me know. I'm going to turn this over, turn this down, and then I got sitting next. All right, so where are we going here? We're gonna go over here and bring my chair around. And then our next question is, what do we do when we're sitting? All right, so we're at home sitting for, at our desk or whatever, and we're thinking, what's the perfect posture or best position to be in if we're prolonged sitting? So I mentioned that there's no perfect posture. We can't stay in one position for too long. The maximum amount of time that I would recommend being in a sitting position is 30 minutes. Every 30 minutes, we should be doing something to restore mobility or the sliding surfaces in our tissues, so we don't get them too sticky or they don't get too stiff. In standing, static standing, I would say that the upper limit is going to be an hour, all right? Standing for an hour is the limit, sitting for 30 minutes is the limit. We want to change our positions out of that. All right, so from sitting, a lot of times people have probably seen this ergonomic setup where the feet are flat on the ground. We've got the knees bent at 90 degrees. The back is against the chair, head and shoulders are lined up, and it's the same thing. And then my wrists, my forearms can be resting on the what we call the armrest. I've got my mouse, my keyboard, all at the same height. That would be ideal, right? But that's a lot of 90-degree angles that our body is in, which isn't ideal because we want to be able to express full range of motion of our limbs. And if we stay at a 90-degree angle at all these angles, that's the way that our body will adapt, especially with the hips, and that relates to our lower back pain. So the one thing I would try and do, just like the Brugger pose that we did in standing against the wall, we could also do it in sitting just to kind of reset our posture. But we can add a little twist to this. So I'm going to get off the back of the chair, going to sit, and like every 30 minutes, I would do at least this. You can do certainly get up out of your chair, walk around, it's even better. But just sitting, and if you're stuck in a meeting and you have to stay focused on this Zoom meeting that might be going for an hour, Then you think, all right, let me just do something in sitting. So we're going to get off the back of the chair, plant the feet, put your hands right on your knees to brace your back. And then we're going to do what's called a slouch and overcorrect. Maybe it's better from this angle. We're basically going to slouch down and then sit up. And as you can see here, I want the motion to happen at the pelvis and not from just the upper back. I don't want to be slouching like this. All right. So the head and shoulders, that's the slouch. I want to set the base first, which is the pelvis and the lower back. So I'm going to slouch. I tilt my tailbone underneath me, and that influences the thoracic spine of the head, right? So that's the slouch position, a big curve. And then I'm going to reverse that and sit up as tall as I can, tilting the pelvis forward, tailbone sticks out, and that influences where the shoulders and the upper back are and where the head is, right? So this is the overcorrection. I could really exaggerate that, crank up. That might not be comfortable, just as this back punched up position is not comfortable. But I do want to feel like I'm going through a sufficient range of motion, again, just to keep my tissues hydrated and keep them loose. So once I'm here, I'm going to go forward and backward, find my end ranges, and then try and figure out where's my 50%. Once I'm feeling comfortable with this tilting position, all right, where's my middle? And then once I set the middle, I can, do the same thing that I did in standing, figure out where my torso needs to be over my pelvis, and then I could do that Brugger pose in sitting. I can go outside of my armrest here if I have the armrest, or you can put them right down by your side. We're going to turn the palms forward and then push the fingers to the floor, maintaining that head, imagining we're up against the wall, chins down, heads up nice and tall, pushing the shoulder blades down, extending the fingers to the floor, and again, feeling that same tension in between the shoulder blades. And I would recommend, again, trying to accumulate at least 60 seconds of tension time to reinforce that muscular endurance for those postural muscles. All right. Another thing that we want to do is to get rid of this 90-degree hip flexion. So oftentimes I like to do, again, is to open up the hip, get that out of that position. Let me back up a little bit so you can see. I'm going to scoot 90 degrees. I've got like half of my cheek on the chair. I can hold on to my armrest for support. I'm going to take this leg and I'm going to open it back. That knee goes behind my hip, or at least below my hip, to get rid of that 90-degree angle of my hip and stretch this out. If I can scooch down to the floor and do a kneeling hip flexor stretch, that's even better. But just opening up this hip would be the bare minimum. Again, for this, I would say hold it for 30 seconds. All right, try and hold that for 30 seconds to open up the hip. And then we're going to repeat, of course, on both sides. All right, so that way we can relieve some of that tightness and fascial restrictions in the front part of your hip that can contribute to back pain when you transition out of the chair into a standing position. So that's a big thing with a lot of clients that I see. If they do spend a lot of time sitting, is that when they go to stand up, because of the tightness in this front hip section, they go to stand and they run out of room of the hip because this is so tight. And then they have to stand. I'm going to exaggerate here. They just extend through the back. So they walk around like that and they think, all right, why does my back feel so tight? It's because the hips aren't able to open up and get underneath you and access that glute activation and wind up with that torso directly over the pelvis. All right, so let's pull this up here. So those are some of the postural exercises that we're doing in standing and sitting. Hopefully you found that helpful. Let me know in the comments or the chat here if you do have any questions of anything specific that you wanted to go over. I want to make this session as helpful and as informative as I can make it. I'll give you a couple seconds to think and type it in. All right, so I hope you found this session helpful and informative. Thank you for joining me today. You could look for this session and many more on demand on any of the Better Spaces apps. I'll be back on Tuesday, December 6th, where we'll be going through a class that I've titled, Let's Go for Snow, Slope season prep. All right, you're going to learn how to prep for ski and snowboard season to avoid pain and injury as you hit the slopes. That's December 6th, Tuesday. Oh, got a question over here. Is it important to keep your shoulders back? Yes, I think it is important to keep your shoulders back because the shoulder position dictates how this upper trap and the muscles that hold your head up are working. So if we keep the shoulders forward, not only does that make a poor position for any shoulder motion that I need to do, like reaching up into a cupboard, because it ruins where the shoulder blade is, but it changes the length of the muscles that are holding the head up. Okay, so oftentimes, just like when we talked about the hip and the back, the shoulders, upper back, and neck are connected in a way that if this is short, then we get this neck that's overextended when our shoulders are forward. And that overextended neck creates that tightness in the back of the neck that we felt in the lower back when our hips were tight. All right, so hopefully that answered your question. Now, that's not saying that, again, it would be preferential to kind of keep your shoulders back. We don't have to walk around like a soldier keeping up the chest out like this. I'm not saying that that is a position that we want to be in. Again, our bodies are designed for motion, but our base, our 0 point should never be here. All right, I want to have the 0 point to be more in line like we talked about on the wall and feel like I can get into a hyperextended position and I can get into a flex position, but I would never want to stay in either one. Both directions or both ends of the spectrum are not ideal.